Welcome to Skills to Pay the Bills. I am your host, Tia Young, and we have a fantastic show for you today. Our special guest today is no stranger to our set. He holds many titles and accolades, but today we are focusing on his role as Chief Executive Officer of Premier Healthcare Services, LLC. Please join me in welcoming Mr. Bobby Lee to our set. Hello, Bobby. Good to see you again.
Today.
Good. I'm glad you were able to pull away from your busy schedule.
Hey, anytime for you, Tia.
Well, listen, I brought the calculator because I figured we might have to do some high financing here, and you got it here.
I'm ready for that.
Okay. Well, let's get started. You know, many baby boomers are retiring, and they're confused about the federal Medicare system. What can you tell us about Medicare and Medicare products?
Oh, I could tell you a lot. You know, with Medicare, a lot of people don't understand, you know, about Part A, B, C, D, or whether it's an advantage or a supplement. You know, and every year with Medicare, you know, you have the book that they send for you, and then, I mean, it's that thick.
Big, yeah.
And you know, sometimes you read it, and there's so much information. That's where, you know, they have agents like myself, where we can sit down and really explain to the customers, you know, if you have Part A and B, why you need to have Part C or D, and you know, if you don't get Part D, you could get penalized for life. Right. You know, situations like that, and also explaining to them what's the difference between an advantage and a supplement plan, why you should get one versus the other. Right. And a lot of time, it's not just that, it's the network or the provider, you know, the star ratings on the plans. So all these things come into account when we talk about Medicare. Yeah. And a lot of time when you call somebody up on the 800 number, they might not be as informative, or, you know, it's always easier when you're face-to-face to be able to explain all of that. So, you know, it's very important that, you know, if anybody has Medicare, to find somebody that, you know, an agent nearby to sit down and really explain to them all the details, because, you know, carriers change every year and plans change every year.
Right, they do. And somebody was telling me about, they also had something that goes from, I think, A to N, and that's another level. And then you get to the prescription pages, and that's another 10 or 15 pages of different things, and people are just confused.
Yeah, and you know, whenever I sit down and talk with a client, number one, I try to find out, you know, if they're sick, if they have any conditions, who their doctors are, what kind of medication they take, so that I can really explain to them, okay, based on these medications, you're either tier 1, 2, 3, 4, or 5, and really calculate, you know, how much money they would have to pay for those medications. Because a lot of time when people sign up for a Medicare supplement or advantage plan, they might not consider that, but that's the most important thing is, can I keep my doctor? You know,
that's true.
And if I have these type of medications, what will I be paying for? So, you know, with that, it's very important that, you know, whoever they talk to have the expertise to be able to dissect and explain all that to them. Right.
Well, Medicare, in my understanding, is supposed to be for people pretty much 65 and over, but can people under 65 take advantage of Medicare benefits?
Yes, if they have a disability of some type, yes, they can have Medicare early, but you know, it's mainly for 65 and over, and you have to have all the credits. I've been working here and having 40 credits in order to qualify. Right. So yes, but once you have that Medicare, Part A is free, Part B, you know, it's $121.80 this year. Right. It went up. Yeah. But if you have a high income, it could be as expensive as $389.80.
Okay, so they have a minimum amount and a maximum amount of
yes, that's just for Part B.
For Part B.
Yes.
Okay.
Yes.
All right. Now Part B services. Now let me go with this. Some people are confused about what it means when you hear original Medicare. Is that just Part A and B, or is that just Part A? How does that work?
So original Medicare is basically Part A and B, which covers 80% of your hospitalization and doctor costs, along with some other costs. And anything that you do when you use your Medicare card is original Medicare. Now, of course, you need to have an Advantage plan or a supplement plan to supplement the 20% that's left over. Otherwise, if anything happens where you only have original Medicare, you might have to pay a lot of out-of-pocket costs, you know, because there's a deductible for hospitalization with the Part A, which is $1,288. There's the deductible with the Part B with $166 for doctors. You know, there's also, if you end up in the hospital, there's also, you know, they charge you by day how many days you stay there. But if you had an Advantage plan, you know, Part C, Part D, it will cover all of that together. And if you have like a supplement plan, especially if you have a F plan, that will basically cover all the costs, so that, you know, you can have peace of mind.
Right. And, you know, as you're talking, I'm thinking, wow, this could get complicated. You really do need an agent to come in and sit down either in an office or that person's home. The agents, are they highly trained? If I call up, am I going to get somebody that knows what they're talking about, or are you just going to get?
I mean, with healthcare alone, any insurance agent, number one, they have to be licensed. But, you know, I do regular healthcare, you know, with Affordable Care Act, Obamacare, or even Medicare. But Medicare especially is very, very protective of their clients. You know, for example, if I wanted to talk to somebody about Medicare, they have to approach me. I can't go up to them and say, hey, you look like you need Medicare, and say, I can help you. They have to approach me first, and then they have to sign like a scope of appointment to agree for me to come talk to them. So Medicare itself as a...
And that's called a scope of appointment?
Yes. As agents, we have to comply to strict rules according to CMS. And of course, there's a lot of certification that we have to do every single year. So, you know, and if we steer away from that, we get in trouble a lot.
Right. Well, you know, that brings up another question. I know once I had and it wasn't on Medicare, it was on something else, but the agent was coming in to talk about one piece of insurance, but by the time they were ready to leave, they were trying to sell me a whole bunch of things, car insurance and some other stuff. So will people have to worry about the agents trying to parlay them into other?
I mean, with healthcare, that is okay, but with Medicare, if I'm coming there to talk to you just with Medicare, on the scope of appointment, I have to clarify what you give me permission to talk about. And I cannot talk about any other products other than the Medicare product that you've agreed for me to talk to you about.
So it's highly regulated.
It's very highly regulated, and you know, all agents have to abide by that. If not, then they could you know, get terminated, where they won't be able to sell Medicare at all, because the laws protect the 65 and over, the Medicare recipients a lot.
Okay, we're going to veer away just a little bit from that, then we'll come back to Medicare. The younger generation. I want to talk about the younger generation. A lot of the young people feel that they have plenty of time. They don't really have to worry about health care right now because they got youth on their side and they're going to live forever and they're not going to have any problems because they exercise and they do that kind of thing. Is that a realistic viewpoint to take to people that are starting out in their first jobs? I
have to say, you know, being in the health insurance business, that is really true. You know, when the Affordable Care Act came out in 2014, the whole goal of the Affordable Care Act was to get more people, younger people, into the health pool. And that's why they mandate that everybody needs to have insurance, otherwise you get penalized. Okay, it went from 1% to 2, now it's 2.5% of your gross, just gross income. So, you know, people have seen lately that every year the insurance rates has gone up higher and higher every year. Okay, and that could be due to the fact that, you know, since the Affordable Care Act came out, they have limited on the carriers how much they can profit, you know, with the medical loss ratio. So, you know, carriers are only profiting a certain amount now because they can't do more than that. But then there's a hot cost to those carriers, because if you get too many people in the pool, but they're more unhealthy than healthy, then your cost goes up.
And if they're older too.
Exactly.
Older people
so the younger
sicker.
people are not buying where they say, okay, I don't mind, I'll get penalized, or whatever the case. And the more of the older generation, or not older, but more of the sick, because the Affordable Care Act says that if you're sick, the carriers cannot deny you. So you're getting more sick people in there, so the costs for the carriers are higher. So that could, that cost could trickle down to the people signing up.
Okay.
So therefore, the rates could go up. But people, when you hear that rates are going up 18, 25%, they really have to take a look at which plan, which carrier. Because with the Affordable Care Act and with all the carriers, plans change every year. Okay, rates change along with what they cover. Whether it's the deductible, the max out of pocket, all of that changes every year. The cost sharing or the subsidies might not change based on your income, but the details of the plans change. So I recommend that anybody that has a health plan, you need to check your plan every single year. Come November 1st to the end of January is when you can do that. Because if you don't, you'll be automatically re-enrolled into a plan similar. Doesn't mean that it's going to have the same coverage.
Right.
Okay? And sometimes certain carriers, they might be in this area this year, and next year they pull out. So,
They're not in your area anymore.
According to healthcare.gov, if you do nothing, they might just give you another company or whatever the case. So if you have any healthcare plans, whether they're through the healthcare marketplace or off, you have to take a look at the new plans this year, see what the rates are, what the coverages are, and it really varies from one carrier to another.
Right.
And also varies from one state or one area to another.
Bobby, real quick, you mentioned healthcare.gov. What basically do they do to help people?
Well, basically, if you enroll in any kind of health plan, you got to go through healthcare.gov because they'll calculate to see how much income you have, what tax subsidy they'll give you, and then you can choose a plan in healthcare.gov because those plans are pretty much similar to the plans outside the marketplace.
Okay.
Okay, but I encourage everybody to go through healthcare.gov to affordable their plan.
Well, what we're going to do, I want to, you touched a little bit upon the Affordable Health Care, also known as the Affordable Health Care Act, also known as Obamacare. When we come back after the break, I want you to talk a little bit about that and some of the media hype that's going on during this, I guess, election season. So we're going to take a short station break. Don't touch that dial. We'll be right back.
Minds can achieve anything. We make sure they get to college. Federal student aid provides more than $150 billion in grants, loans, and work-study funds to make college possible for anyone with the mind to get there. Because if given the chance, minds will do great things. Federal Student Aid, proud sponsor of the American Mind. Learn more about money for college at studentaid.gov.
Welcome back. You're watching Skills to Pay the Bills featuring our special guest, Bobby Lee, CEO of Premier Healthcare Services, LLC. Bobby, before the break, we had touched a little bit upon the Affordable Health Care / Obamacare. Over the last couple of weeks, there's been a lot of media discussions about the affordable health care just going up just astronomically 18 to 25%, and millions of people are calling up mad and they don't want it anymore. And I'm thinking, just as a layperson, how do you know until you compare and see what that is? I talked to a young lady and she's paying something like $125 right now. It'll take her plan up to $150, I think. But when she checked all of the other major companies, that same plan was going to cost her almost $300.
Yes.
So,
Then let me explain how that works. So, yes, every year with health insurance, it does increase, okay? Now, you might listen to the news and they give you a number, but it all depends on what plan and what carrier. So let's just say in this area you might have, you know, companies like you know, Aetna, Kaiser, Care First, Anthem. You know, those are the major players. You know, you might have, you know, companies like Cigna and United Healthcare, but with the health insurance, it's location, location, location. So, you know, when you have a carrier that, you know, last year you paid 100, this year you pay 300. The reason could be that last year they did have a good plan here, but then this year they might have taken out some of the plans, but they still want to be able to play in the market. So they might have a plan that is the most expensive plan. But, you know, it still may be a good plan, but because they might not have a lot of people, or that might not be like a big plan with a big network, they have to charge those prices in order to make sense for them to even have the plan available. Right. You know, but then you have other plans that's way cheaper that can offer you more as far as coverage. The deductible could be lower, the max out-of-pocket could be lower. So that's why, you know, when people say, hey, you know, the plans increased from 18 to 25%, take a look at which plan that is. Right. You know, every level plan is a little bit different. You know, last year you might have a zero deductible, but this year you might have a $100 deductible. But at the same time, last year's max out of pocket might be $3,000, but this year they brought it down to $800. So, you know, the price might have gone up here, but the coverage might be better at some other aspects. So you really have to take a look at the details of the plan itself before you draw the conclusion and say, oh, this is too expensive, you know, I can't afford it. But what are you really affording? What are you really buying? That's the most important part. That's right.
Now, you've been doing Obamacare ever since I think it started. So what has your, and you've got a lot of clients, I think you probably got over 300 or 400 clients.
Over 1,000. I mean,
oh my gosh.
I was the number one producer for Virginia, D.C., Maryland.
Oh,
so,
okay.
You know, but you know, I also have a radio show where I talk a lot about Obamacare. I talk a lot about Medicare to explain to people what it really is, how it's affecting us, and even, you know, people call me up and ask, okay, how does the deductible work, and, you know, all those questions. Right.
So I wanted you to talk a little bit about your experience with your clients. I mean, are your clients, have they been happy with it, or because if you listen to the media, it sounds like it's the worst thing ever.
I tell you what, let's just say this: a lot of people that do have the tax subsidies, they're thrilled. You know, for some people that are paying full price like myself, you know, they might not be happy, but then once they understand what they're paying for, where, you know, those 10 essential benefits, where if you're sick, they have to, you know, sell it to you, and they cover everything under the sun. So because of that, then they can say, oh, okay, now it makes sense. It makes sense. You know, but when they don't understand, when they don't understand something, they might hate it, but that's all you got right now is Obamacare. Right. There's really nothing else. Right. You know, so what do you have that to compare to? I mean, you can't compare what now to 5 years later. Things change every year. Right. So unless you have something else to compare it to, then you can tell me that it's bad or it's good. Right. So, you know, people have different views. You know, the ones that have the tax credit that's paying $30 a month, of course they love it. Right. But somebody that's paying full price, if he's not looking at everything he's paying for, he might not, you know, he might think it's unfair, or, you know, might think that, you know, this is not worth it. Right. But at the end of the day, that's all we have right now. Right. I mean, unless you can give me, you know, something else to replace it, or then, you know, we have to live with what we have. Right. Well, and the people that I know that have it, they've been thrilled with it. There are some things that probably could be tweaked, but, you know, the powers that be just need to get together and tweak what's not working and fix it. And I agree with you totally with that. I mean, just like once the first, second year came, even the providers, they have an influx of clients, and they're trying to catch up with that by providing more doctors. And, you know, just trying to catching up with that has a lot of the cost, and that's why there is an increase. And who's going to pay for that? Of course, the patients. Right. That's right. It is. Well, let's go back a little bit to the Medicare. Right now, we're in the, I don't know if we're in the beginning or in the middle, I guess maybe kind of the beginning of open season.
Talk to our viewers about open season, what it is, and what some of those dates are.
So open season for Medicare is October 15th to December 7th. So this is the time where you can change your Medicare plan, especially with the Advantage plan, because with the supplemental plan, you can sign up for that any time of the year. But with the Advantage plan, this is the time that you can change your plan. But after the December 7th, unless you have a special reason where, that goes into the special enrollment period, then you can, change your plan, But there are certain carriers that will allow you, let's say a 5-star carrier will allow you to change your plan even if you don't have a special enrollment.
Now you talk about the stars. You mentioned that a little earlier. What do those stars mean? You go up to is 5 the max?
Yes, 5.
Okay.
Kaiser is a 5-star. And other companies 4.5 stars, 4 stars. But the bottom line is when you look at the plan, there's a star rating there. It's basically they rate it on the service. There's a lot of things where in order to get that type of rating, you have to provide the quality service. So it's very important when you choose your plan to kind of take a look at that. Make sure nothing's like under 3. I think even with Medicare, I think if anything is like 2.5 or so, I don't think those carriers can even sell their plans.
So when we talk about major carriers, we're talking about, like you said, Kaiser, Aetna, Blue Cross Blue Shield.
Yeah, Blue Cross Blue Shield.
Those are the
United
Healthcare. Those are the ones
companies.
that are the major companies.
Sometimes a 5-star plan might not suit the client because of their needs. So, the star rating I share with my clients after I understand their needs, because, just because it's a 5-star rating, the client might not need the services of that plan. So for me, it's more important to understand the needs of the customer in order to, really show them which plan will fit their needs, because every plan is a little different.
Okay.
Yes.
So let's say that I'm a client and I'm going to be a future client of yours, and I'm ready for Medicare. Walk me through how I would get in contact with you, and then once you come to me, what kind of documentation do you need? What kind of process will we go through, and how long will it take? Will it take me 4 months before I get that card saying that I'm, on Medicare? How does that work?
Well, usually when you initiate the conversation by calling me, then I would come out to get a scope and appointment with your agreement that you allow me to talk to you. So once I sit down and talk to you, I would want to know who your doctors are, what medication you're on, and understand your situation and your needs. Then I can show you a few plans that fits your needs, and then we do the paperwork. I send it in. Within 7 to 10 days, you should get a answer from the carrier to let you know, if you're approved or not, and everything is done. I mean, let's just say now, if I do an Advantage plan, more likely the effective date will be the 1st of January. If I do a supplement plan, that could be the 1st of the next month. Because the supplement plan you can sign up anytime, but the Advantage plan, only for open enrollment, and the effective date is the 1st of January of next year.
Okay, so even if we signed up now and I got approved and everything, I wouldn't start paying for that until January.
Well, actually, you will pay for it first, but you can't use it until January. Because if you don't pay, you're not going to get your card.
Right.
So
you pay up. Okay.
Yeah. Okay. So most people they take it out of their bank account, and once all that has been processed, you're covered, and the effective date will be the 1st, or if you're doing a supplement, it's the 1st of the next month.
Now, some people will opt to just take just the prescription drug plan, which they have to have A and B. They have to already have that. Can you just talk a little bit about that, the prescription drug plan as a standalone, and then as an Advantage plan? Well,
in the Advantage plan, they cover the drugs as part of its Part C and D. But if you do a standalone, it's usually when you pick a supplement plan, then you need a standalone plan. But if you don't do the supplement plan, it's okay too. But just remember, you have to use original Medicare, which only covers 80%.
Right.
And there's no, limit as to what you're going to be paying out of pocket. So you need to protect yourself by getting, the Part C, Part D, or a supplement with a standalone prescription drug plan. Because if you have Medicare A and B and you don't get Part D, you will get penalized. Okay, for how many months that you didn't have that plan, and you will be penalized for life on that. It's a small amount, but I've seen people where 10 years they didn't have the prescription, and they got fined. It's a nice amount.
Wow.
So you got to be careful with that.
So if you don't take it when you're eligible to take it, and then you come back later and try to take it,
you'll get penalized.
You'll get penalized for that.
Yep, just for Part D, for not having Part D.
That's not good.
That's why you got to be informed. You got to make sure that you talk to somebody about it.
Well, we have just a little over a minute. If a person is 65 or older, is there any reason they can be turned down for Medicare?
Only with the advantage if you had the kidney renal disease, then you could be turned down. But with the supplement plan is based on your health also. Okay, so there could be reasons where you could be turned down, but more likely the advantage, there's only one reason why you would be turned down.
Okay, all right. Very good. Bobby, thank you. I think we've covered a lot in this 30 minutes. The time just has gone by. so thank you so much.
Thank you.
And
thank you for having me.
I really want us to sit down and talk about your coming on, just doing a healthcare summit, a segment. I said summit, but I meant a segment for us. I mean, I'd really like you to do that because I think you bring a lot to the table.
I would love to.
In the form of information and education. So we'll talk about that.
Yes, ma'am.
Very good. Folks, your health care matters. Don't wait another minute to make sure that you are adequately covered. Do it right now. Have a great week, and we will see you right back here next week for another engaging show on Skills to Pay the Bills. Bye-bye.